Good morning, dear students. Today's topic is the etiology of carpal tunnel syndrome. I will give you the mnemonic. Donald Trump is foolish. Donald Trump is foolish. Let us elaborate it. D. Diabetes, overuse, neoplasm, acromegaly, low thyroid, that is hypothyroidism. Diabetes related amyloidosis, trauma, rheumatoid arthritis, use of aromatase inhibitors, max edema, pregnancy. Forget about this is eliminate L and I. It becomes push. That is fall on outstretched hand. Write down this mnemonic. I will give you 2 minutes. You wrote it. I'm going to erase it. This is the mnemonic. I should use the capital letters. This is your mnemonic. Remember it for your whole life. Now, we will see one by one how these etiological factors, how they are responsible. We will see the mechanism of the development of carpal tunnel syndrome. D. Diabetes. There occurs the glycosylation of tendons. It causes inflammation. Once inflammation occurs, it causes the decrease in the lumen of the carpal tunnel. That means the compression of median nerve. Overuse, there are repeated awkward movements which irritate the tendons. Irritation of the tendons causes inflammation. Inflammation causes the decrease in the effective lumen and the compression. And neoplasm. can be the benign, such as ganglionic, any cystic ganglionic swelling, ganglionic cystis, vascular tumors, nerve sheath tumors. All these causes the decrease in lumen and the compression. Acromegaly. There is increased secretion of the growth hormone from the somatotropes of the anterior pituitary. Growth hormone hypersecretion from the somatotropes. That is why it is also called somatotropin. Growth hormone is also called somatotropin. What is the problem with increased secretion of growth hormone? It causes the retention of sodium, which follows the retention of water. That means the swelling within carpal tunnel and the compression of median nerve. That's it. Hypothyroidism. It is low thyroid. Low thyroid means hypothyroidism. Letter here is L. In hypothyroidism, there is the deposition of mucopolysaccharides, such as your glycoaminoglycans and hyaluronic acid. When they get deposited, so they cause compression with the carpal tunnel and the development of carpal tunnel syndrome. D. D means diabetes related amyloidosis. Diabetes related amyloidosis, it occurs in the people who are on chronic dialysis for greater than 5 years. In these people, the beta-2 microglobulin it gets deposited within the body tissues. When it deposits within the carpal tunnel, so there occurs the compression and the development of carpal tunnel syndrome. Amyloidosis is actually, what is amyloidosis? Amyloidosis is any disease in which there is the deposition of abnormal protein. This abnormal protein is called amyloid. So the amyloid which gets deposited in diabetes-related amyloidosis is beta-2 microglobulin. You should remember it. This is the disease of which the ex-president of Pakistan, Pervez Musharraf, he died of this disease. Should I erase it? T. Trauma. Most common is Cooley's fracture. It causes the compression. In trauma, the mechanism, it can cause direct compression within the carpal tunnel and the development of carpal tunnel syndrome. Also, in trauma, there is the inflammation occurs. That is also another reason how in trauma the compression of the median nerve occurs. or rheumatoid arthritis. In rheumatoid arthritis, there is the laxity of ligaments, laxity, joint erosions, and edematous synovial swelling. All these factors cause compression of median nerve within the carpal tunnel. Use of aromatase inhibitors. What are these aromatase inhibitors? These are the group of drugs which are used in people with breast cancer. Hormone dependent breast cancer. Actually, there is an enzyme which is called aromatase. Aromatase inhibitors causes the inhibition of aromatase. So the function of this enzyme aromatase that is not accomplished. What is its function? It causes the conversion of androgens into estrogens. The enzyme is aromatase. When it gets inhibited, there is no longer the further conversion of androgens into estrogens. So there is decreased estrogen production and a decreased level in blood. Decreased level in females causes the increased bone turnover. That means that there is tendency of degradation, degeneration. Joints get degenerated. Joint degeneration means when joints get degenerated means the inflammation and the subsequent compression. Max edema. Max edema is the severe form of hypothyroidism. People who do not treat their hypothyroid condition effectively or who do not show compliance with the treatment. So the result is severe hypothyroidism, and the mechanism for the development of carpal tunnel syndrome in max edema is same. That is the deposition of mucopolysaccharides and the decrease in the lumen of the carpal tunnel and the developed compression of the median nerve. P. Pregnancy. How pregnancy causes carpal tunnel syndrome. So in pregnancy, there is the hormonal surge from the adrenal gland. Your adrenal cortex causes increased secretion of mineralocorticoids. Mineralocorticoids such as aldosterone. What aldosterone causes? It causes the retention of sodium, which follows the retention of water. That means the swelling within carpal tunnel and the development of carpal tunnel syndrome. The loss is the fourche. Loss is your fourche. The fall on outstretched hand. It causes the lunate bone dislocation. The lunate is a carpal bone, it gets dislocated. Lunate dislocation, which usually occurs with the carpal tunnel and the compression and development of carpal tunnel syndrome. And the loss is the idiopathic. What is idiopathic? When there is no known pathological process. Pathological process is responsible for the compression. No pathological process responsible for the compression within the carpal tunnel. Then we say this is the idiopathic condition. There is in people who are having the idiopathic carpal tunnel syndrome, there is increased genetic predisposition for the condition. That is it. Class dismissed.